Botox works by preventing muscle contraction. The reason that we have wrinkles are because our muscles are constantly moving, which creates lines on our face. Botox can be used on multiple areas of the face, but the most common are these lines here, your 11s, these forehead lines here, and your crow's feet. Botox feels like a little mosquito bite. Usually you'll have a little raised bump that stays red for about 10 or 15 minutes and then it dissipates. We have two different neurotoxins here. We use Botox and we also use Dysport, and the difference is really just the size of the molecules. With Botox, you'll notice an effect within 5 or 7 days, and usually with Dysport, it's a little bit faster onset of about 3 or 5 days. Both of them have a maximum effect of 14 days, and that's typically when we have you come back for a follow-up. We assess your face and the muscle movement again, and if you wanted to add more, we would do so at that time. Botox lasts on average 3 to 4 months, and sometimes Dysport lasts a little bit longer, usually 4 to 5 months. People can get Botox as early as their 20s as a preventative measure, and we typically see a lot of people in their 30s, 40s, 50s, even 60s coming in just to have that wrinkle prevention or to treat the wrinkles that are already on their face.
I came to Dr. Moran because I was interested in getting some procedures done, and I think it's very important to have procedures done with someone who is well trained, and her acumen in having her be a physician I think was very important. I wanted to get Botox because as a 54-year-old woman in a sales position, I think it's very important to have that refreshed look about yourself, and I think that Botox gives you that sort of natural look. So after getting Botox, it really just makes me feel youthful in a way, and I just feel that it gives me that confidence when I'm out presenting that, you know what, I'm killing it.
We would welcome you to come in for a personalized Botox consultation where we can go over any of your questions you may have.